Hey family, it's Dr. Yola again, here for the third part of our 5-part series on kids and COVID. For this particular part, I want to talk about symptomatology. How do children present with COVID-19 and how are they different or similar to adults? Let's start with the good news. The good news is that children are more likely than adults to be asymptomatic after developing a COVID-19 infection. They're also less likely to have severe symptoms compared to adults who are COVID-19 positive. So that's something to celebrate. Actually, the National Academies of Medicine just recently released a report demonstrating that over 90% of children with positive COVID-19 cases were either asymptomatic or only mildly symptomatic. So I think that's excellent news when you compare it to the adult population. On average, about 80% of adults are either asymptomatic or mildly symptomatic. And this may explain why we just assume that children are relatively immune. But that's, again, not the case. There's still that 10% of children who have moderate to severe COVID-19 symptoms. And let's talk a little bit about what those symptoms are. On average, the most common symptoms that children experience are fever, upset stomach, decreased appetite, nausea, and vomiting, right? And it doesn't seem like a big deal unless you're a parent or a kid experiencing those symptoms. But we also have very significant symptoms that a small portion of our pediatric population does experience, something called multi-system inflammatory syndrome. And although this syndrome has been demonstrated to be very rare amongst little ones here in the U.S., it's still scary. There's still the risk of it happening, and you just don't know which child is going to be that child to develop multi-system inflammatory syndrome. So let's talk about that for a little bit. It's been compared to something called Kawasaki disease. Kawasaki disease is an inflammatory process that us pediatricians have been aware of for years. It's inflammation of the small blood vessels of the body. So the speculation is that COVID is causing inflammation similar to what we see with Kawasaki. And the way that we know that is based on the symptoms that little ones present with when they have this multi-system inflammatory syndrome. The concern with this syndrome is that it can impact brain function, kidney function, cardiovascular function, and your digestive system. And that pairs with the symptoms that we see children developing when they acquire multi-system inflammatory syndrome. So let's talk a little bit about the symptoms because it's important that parents and caregivers can recognize it because it requires immediate medical attention. All right. Now with Kawasaki, there are these standard classic diagnostic criteria, meaning a child must have this, and this in order to meet Kawasaki classification. Otherwise, we call it what's called atypical Kawasaki, where they don't meet all of the diagnostic criteria. With multi-system inflammatory syndrome, you see a very similar pattern of the symptoms that are included with Kawasaki. Those include fever, and usually relatively high fever, 101, 102, for several days. It isn't one of those, a little bit of fever, you felt that they were hot, and that's how we document it. That's why it's important. I'm going to take a sidebar to make sure that parents have several things in their arsenal in order to be able to assess what's going on with their children. One of them is a thermometer. Everyone and their mother is now buying thermometers. They're getting the infrared ones. It doesn't really matter which thermometer you get, depending on the age of the child. If you have a big kid, a little one over the age of 2, you can use under the arm, beneath the tongue, the temporal scanner, the whole 9. For little bitty babies, the temporal scanner has been shown to measure temperature fairly accurately. The most accurate temperature for a baby is a rectal thermometer check. So there you go with that one, right? But for any little one, you want to make sure that you have the capacity to measure their temperature. So you should have a thermometer at home because you want to know what the fever pattern has been over several days. And if a little one has a fever of 101, certainly within even that day in their speculation that you may, or he or she may have been exposed to COVID, that warrants calling your healthcare provider. So fever is one of the diagnostic sort of red flags for multi-system inflammatory syndrome. The other symptoms include bloodshot eyes. It includes a swollen lip or tongue, or a very bright red tongue. You can get what we call cervical lymphadenopathy, tender lymph nodes in this area, bloodshot eyes. These won't look like your classic pink eye with crust and boogies and all those things. The eyes will look bloodshot. And it will stand out to you. You will definitely be able to recognize it. Little ones can get swelling and redness of the palms of their hands and the soles of their feet. They can develop a rash all throughout their body, usually from the trunk all the way down to their legs. They will sometimes complain of stomach ache. They may have nausea, vomiting, or diarrhea. If your child develops a combination of any of those symptoms, I would definitely encourage you to seek out your healthcare professional, because if a child is diagnosed with multisystem inflammatory syndrome in the same way we would approach Kawasaki, they need to be admitted for special medical treatment. What we know, as I mentioned earlier, is that this is likely a result of the inflammatory process that COVID-19 triggers. And in order for us to be able to manage the inflammatory process that's attacking the brain, the kidneys, the cardiovascular system, the digestive system, there are specific medications that we need to give, and it has to be administered in the hospital in order to bring the immune response down. So that's multi-system inflammatory syndrome. As I mentioned before, it is rare. We have lost, I believe, one child thus far to multi-system inflammatory syndrome, but here's the caveat. Again, children were under stay-at-home orders in the same way that us adults were. And when we start putting our little ones in tight spaces in classrooms, it increases their risk of exposure to COVID-19, which will likely increase the number of cases of COVID-19, and then potentially increasing the number of cases of what we have previously considered to be rare diseases. And it isn't to say that we should or should not reopen schools, but we have to do it in a very careful and methodical way, not underestimating the impact that the decisions that we adults make, what that will have on our little ones. Because if the multisystem inflammatory syndrome was rare when only a handful of children were intermixing and having risk of COVID-19 infection, when you increase the risk of COVID-19 infection and transmission, do we not also increase the risk of something like multisystem inflammatory syndrome? So those are the things to look out for in terms of symptoms. And clearly, they're still your standard COVID-19 symptoms: cough, shortness of breath, all of those things that we still need to be aware of. But when we look at the data, the majority of children have presented with fever, feeling very fatigued, and stomach upset, nausea, vomiting, diarrhea, and decreased appetite. So keep those in mind as we move into the fall, into the winter, and as we get ready to go back to school in whatever capacity your little one is going into, all right? So that wraps up symptoms. Next up, we're going to be talking about a return to school strategy. I'll see you then. Dr. Yola out.